The primary focus of the Colorado Cancer Screening Program is supporting safety net clinic systems across the state with implementing evidence-based interventions, also known as EBIs, for colorectal cancer screening, as well as some work in lung cancer screening and hereditary cancer risk assessment. And when we refer to evidence-based interventions, those mean interventions that have a body of evidence from systematic reviews and other studies that show the effectiveness of those interventions in changing patient outcomes. So examples of EBIs include things that affect patients as well as providers, like provider reminders, patient reminders, and then things more on the clinical level, such as patient navigation services. And EBIs, or evidence-based interventions, there's a collection of EBIs for colorectal cancer screening services that is through the Community Guide, which is developed by a task force called the Community Preventive Services Task Force, made up of a group that is appointed by the CDC. And they review the body of evidence of interventions and then are able to make determinations of which ones are evidence-based. And so CCSP is working on many different evidence-based interventions, but one of the primary has been patient navigation throughout the life of the program. Patient navigation has been the primary strategy of the Colorectal Cancer Screening Program, CCSP, now called the Colorado Cancer Screening Program, since the start of the program in 2006, and was the primary strategy through 2023. Patient navigators are housed at the participating clinic systems, safety net clinic systems, which are federally qualified health centers, as well as rural health clinics and critical access hospitals. These designated patient navigators, as well as other members of the clinical team, implement patient navigation services, which can include things such as patient education on a one-on-one basis, reducing structural barriers of patients, such as transportation needs, interpretation and translation needs, setting up appointments, patient reminders, other care coordination needs to ensure that patients who need additional support with completing their clinical services, including colorectal cancer, are able to move throughout the continuum of care and receive the support they need. At all of the 15 to 20 participating clinic systems in CCSP, clinics may have 1 to 2 patient navigators who are providing all of those types of services, or the patient navigation services may be divided by multiple members of the care team, including also medical assistants, administrative assistants, care coordinators, as well as patient navigators. And the CCSP provides technical assistance and support to ensure that all of the patient navigation services in the colorectal cancer screening continuum have a designated person who's responsible for each component, that it's documented in the workflow, and that patient navigators and those providing those services receive training that they need to successfully serve their patient population. There are many types of patient navigators. So there can be those that are more clinical patient navigators with a licensure, such as nurse navigators, social work navigators. And then there's also patient navigators who are considered professional patient navigators and may be from the communities that they serve. Those professional patient navigators without a special licensure are the primary patient navigators working on colorectal cancer screening through CCSP. And to ensure that they have training to successfully be able to fulfill their roles, CCSP has supported those navigators with going through a formal training program that allows them to receive enough training to sit for the Colorado Health Navigator Registry, now called the Colorado Community Health Worker Registry. And by completing that exam and passing that exam, navigators then will be listed on that state registry, which is held by the Colorado Department of Public Health and Environment, and shows that those navigators have achieved training to be able to successfully serve those patients, and that will also make them eligible for reimbursement for patient navigation services by Medicaid as well as Medicare. Through CCSP's focus on patient navigation from 2006 to 2023 as the primary strategy of the program, patient navigators at all of the clinic systems participating in the program have successfully navigated patients into over 39,000 colonoscopies over the life of the program, really demonstrating the reach of patient navigation for colorectal cancer screening using colonoscopy. And you can really see some of the impacts of patient navigation, not only in the number of patients reached, but some of the outcomes of those colonoscopies. So of those patients navigated into colonoscopy, there was over a 95% bowel preparation rate that was adequate, and that allows for complete exams of the entire colon, and over 97% of those colonoscopies were complete exams, which allows for strong identification of polyps within the colon, and therefore colorectal cancer screening prevention of colorectal cancer, as well as early detection and treatment, so that patients can receive the best possible care and outcomes.